CVIM, Community Volunteers in Medicine. Community Volunteers in Medicine, otherwise known as CVIM, is a registered charitable organization located in Westchester, Pennsylvania. CVIM is supported 100% through philanthropy, and it opened its doors to its first patients on May 18th of 1998. This was thanks to the leadership and trustees of the Women's Auxiliary of the Paoli Hospital Foundation and other very generous benefactors. CVIM is celebrating its 19th anniversary this year. The clinic was started to provide health care, hope, and healing to uninsured working adults and their children in order to reduce costly emergency room visits and hospital admissions. The leadership at CVIM consists of a president and CEO. The president and CEO is one person. Her name is Maureen. I met her yesterday during my visit to CVIM. She was very helpful, very knowledgeable, very excited about what she does, and it truly was an amazing visit. The board of directors, most of which were actually present during my visit yesterday. I was there in the afternoon around 2 o'clock. Very busy place. There's also a clinical leadership, which consists of a vice president of medical affairs. That would be Dr. Mary. And there's also a vice president of dental affairs, which is Dr. Thompson. They also have an administrative leadership, which consists of a vice president of dental services, the vice president of development, the vice president of patient care services, a vice president of operations, and a director of finance. And of course, the volunteers. Some of the professional roles that you will find at CVIM are physicians. There are medical specialists. Every couple days they rotate. So yesterday while I was there on a Wednesday, it was an OBGYN day, endocrinology was there, neurology, I believe, and then just general medicine was also there. And then they may switch, cardiology may be there on a Monday. All the visits are scheduled ahead of time, just like you would call the doctor's office and schedule a visit. And they typically do that, for the diabetics with endocrinology. They come in on Tuesdays, Thursdays, and they try to keep it a consistent schedule so the patients know what day their doctors will be there. There's also dentists and dental hygienists. Also, several dental students from Temple rotate through there. They're usually in their last year of dental school and are pretty independent with their dental care, but the Dr. Thompson does oversee their care. He is one of the very few positions there that is actually a paid position. There's nurse practitioners, registered nurses, there's a diabetic educator who's there every day, social workers, pharmacists and pharmacy techs, nutritionists, and all of these professionals are licensed in the state of Pennsylvania, and almost all of them, like I said, are volunteers. Some of the services that you will find are at CVIM include dental care, diabetic management, drug dispensing. They consider theirs to be a dispensary, not a pharmacy. They're very clear about that. They have general medicine, and they do lab draws there right on site, and they are picked up twice a day by Chester County Hospital. Health education, health promotion, orthopedic care, pediatric care, physical exams, smoking cessation, and nutrition and weight management. CVIM provides primary, medical, and dental care along with health education to those people that live or work in Chester County who lack the access to insurance. It is located at 300B Lawrence Drive, Westchester, PA, and it was recently expanding. They actually recently expanded their site. It had been much smaller. They are now much bigger, and I believe that they will continue to grow with the volume of patients I saw just in their waiting room yesterday. They did recently expand their dental care to Surrey Services in Devon and St. Rocco's Parish in Kennett Square. Some of the students from Kennett, Octorara, and Avon Grove School District will be bused by the school district if they're eligible to be a CVIM patient and when they are in need of dental care, and the buses will take them to and from, which is amazing. The funding for CVIM, which includes primary medical care, comprehensive dental services, and free prescription medications, are all provided to uninsured families earning less than 300% of the poverty level. The care here is provided by compassionate volunteer licensed health professionals and a support staff in a primary care setting. The operating budget at CVIM is entirely supported by a generous community. I mean, very generous. Foundations, corporations, faith-based organizations, United Way, and other local civil groups. Many of the eligible individuals are Spanish-speaking. Interpreters are available, and many of the volunteers are bilingual. While I was sitting yesterday in the waiting room waiting to meet with the CEO, every seat in that waiting room was full, and I'm going to say there's probably at least 40 seats in there, maybe even more, from children all the way, to grandparents. But there was definitely a language barrier, and some of the college kids, volunteer their time that are Spanish majors or are fluent in Spanish. They were all out there trying to help them, decipher paperwork and kind of guide them. And it was just really neat to see that, there are people willing to help them, and the patients were very, very appreciative. The care is provided to those who are eligible. The gross income eligibility must be 300% below the federal poverty guidelines or less. A counselor will meet with an individual and their family to determine their eligibility. One cannot be eligible for medical assistance, Medicare, the Veterans Benefits, or Children's Health Insurance Program, which is otherwise known as CHIP. They did mention to me, though, while I was there, that, with the young children, if they, they get a minimal amount per year. I want to say $1,500, but that might be too much. They said that, once they've used that up, they are eligible to continue their services through CVIM, because I guess, for these kids that need, dental services, it really is a big, it doesn't really come close to providing what they need, so they can then use the CVIM. Eligible candidates may not have private insurance, and there are no charges, bills, or insurance forms to fill out. Everything is free of charge. In 2015, CVIM launched its mobile dental program. This program emphasizes proper dental hygiene, education, and creates awareness about the services offered to the vulnerable communities and populations in Chester County. The mobile dental program has been instrumental in Chester County, truly. As a school nurse, a lot of kids can't get their dental exams done, and it's a school requirement, so sometimes we can have it arranged that they can go here to get their dental exam done. They also do sometimes provide the doctor. The doctor will come to us once a year. They will come to the elementary schools, and that's all arranged through CVIM. They do have something called the Sealant Saturday, and this is open to the community, not just patients that go to CVIM. The dental sealants are thin, tooth-colored coverings painted on the back teeth to prevent cavities. This is for children ages 6 to 16, so anyone that needs this can certainly go. They've recently started cooking classes to, encourage a healthier lifestyle, and they, do show them have a little cooking area and where to get some of the supplies. Most of the supplies are through the Chester County Food Bank for the cooking classes, and then they also send the patients home. The patients from CVIM home with the supplies that they need, and that's all given to them through Chester County Food Cupboard. Then also the smoking cessation class, they have that available if someone is willing to, they try not to push them. They said they do it when they're ready. And not everyone is ready to do it, but they do have that as an option. And then the newest thing that they have been offering is the vision van for those requiring eye exams and glasses. This is really great for the young elementary students. The Lions Club used to be very helpful with providing eye exams and transportation to and from, and getting glasses to the children that were struggling in the elementary schools and the middle schools. Actually all. But lately it's been really hard and it's been challenging to get that approved. So this vision van's been great, and they're coming twice a year to the schools, to try to find those children that are at risk, which I think is wonderful. And then the history of CVIM. In 1996, the Paoli Memorial Hospital Foundation and, like I said, the Paoli Hospital Women's Auxiliary set aside funds to start CVIM because there was increasing awareness of the numerous emergency room visits for non-emergent problems and the non-insured patients in their community. The Paoli Hospital Women's Auxiliary continues to help the community in many ways. They really do help our community, and they look for those populations that really can use some help. They are still involved heavily in CVIM. Many of the physicians at CVIM are retired physicians of Mainline Health and Paoli and Bryn Mawr Hospital. In 1998, CVIM became the first community-based volunteer clinic of its kind in southeastern Pennsylvania. CVIM has continued to expand over the years. They currently they think in 2015 they purchased the building that they had been renting, and that allowed them to expand. And they have 11 medical exam rooms, 7 dental chairs, and little, it's all like one big room, but they're all separated. A large waiting room and educational training rooms. The community benefits from CVIM in so many ways. I can't even list them all, but it basically serves as a health education resource center. It improves the health and well-being of our community. It keeps people in the workplace and keeps people healthy. Minimizes expensive hospital visits and emergency room care. There's follow-up and there's continuity. They get to know the physicians and they get to know the nurse practitioners. It is truly like going to a primary care physician's office where everyone is involved and all hands on deck kind of approach. Everyone here is treated with compassion, dignity, and respect regardless of one's socioeconomic status or racial ethnic background. Providing health care, hope, and healing is CVIM's motto. They do tons of things about prevention here. They provide primary, secondary, and tertiary care services. If someone needs to see a specialist or needs some extra, care, they have Partners in Crime, which is a program that allows patients to be referred to local hospitals for testing and radiology tests at no charge. And typically Chester County or Paoli Hospital, considering we live in Westchester. If hospitalization is required, CVIM will work with the provider to facilitate appropriate and cost-effective care. There are non-narcotic medications, which are all donated by numerous pharmaceutical companies, and CVIM works with medical specialists and dentists, schools, universities, government, hospitals, outpatient centers, and health and human service organizations. In summary, CVIM was an absolutely extraordinary place. I was just blown away by it with all the services and the atmosphere and everyone just, pitching in to help, people in our community. I learned a tremendous amount during my visit. It's a huge resource for our community here in Westchester, in Chester County. I shouldn't just say Westchester. It just seems like a lot of people from Westchester go there, but there's people coming from Coatesville. I saw people coming on a bus. I saw people walking. I saw people getting dropped off. So there was all kinds of ways that people were getting there. It's a great teaching facility. People are happy. People want to be there. People want to provide care. The doctors are happy, and everyone. It was just a happy place. I would love to spread the word and its mission to others. I did drop off some pamphlets at my school nurse meeting yesterday, and my home care job. I was in touch with our clinical educator there as well, so that she could spread the word amongst the nurses. The waiting room was completely full. Like I said, everyone seemed happy and enjoyed what they do. And I know that when I finished my BSN, considering it's right up the street from my house, I would love to volunteer my time there and be a part of this amazing place. If you'd like to learn more, you can find the information at www.cvim.org.